Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Here we're going to compare the difference between the hanging as well as the strangulation ligature. So hanging versus the strangulation ligature. So how is the nature of death? Hanging means it's going to be suicidal, this we know, and strangulation means it's going to be homicidal. So how is the face? So when you look at the face, in case of hanging, it is going to be pale as well as there is petechiae are rare. So the face is going to be pale. This is in case of the hanging. So we'll be writing on the hanging so that it's easier to understand. In case of strangulation by ligature, it is going to be congested, livid and marked with the petechiae. So the face is going to be pale in case of hanging. In case of strangulation, it is going to be congested. Next, what about the tongue? The tongue is going to be swelling and protruded and protrusion is less marked. So it is going to be swelling. So in case of hanging, the protrusion is less, or we can put it this way, that in case of the strangulation by ligature, it has more, there is swelling of the tongue as well as the protrusion of tongue. There is protrusion of the tongue is seen. Next, when you look at the bleeding from the nose, the mouth and the ears is not common. This is in case of the hanging. Whereas in case of strangulation, the bleeding is common. There is bleeding. So where is the bleeding taking place? It is from the nose, the mouth, the ears. It may be found. Next is the saliva. The saliva, it often dribbles out from the mouth. This is in case of the hanging. So it is very common. You can see it in case of autopsy as well. There is often dribbles out of the mouth. Whereas in case of strangulation, the dribbling is rare. So there is one thing which is coming, that is there is bleeding, there is blood which is pouring. So there is no saliva in case of the strangulation. Whereas in case of hanging, there is only saliva which is dribbling, but bleeding is very uncommon. Now let's look at the ligature mark. This is very important. In case of ligature mark, it is oblique, it is non-continuous, it is placed high up in the neck between the chin and the larynx. So it is found in case of hanging. So let's look at hanging. So in hanging, the ligature mark is between the chin. So it is between the chin and the larynx. So the ligature mark is between the chin and the larynx. Whereas if you look at in case of the ligature, the strangulation by ligature, it is horizontal or transverse. It is continuous around the neck and it is low down in the neck, below or across the thyroid. So we need to know one properly, that is in case of the hanging, it will be between the chin and the larynx, whereas in case of the strangulation, it is going to be horizontal transverse around the neck and low down in the neck, below and across the thyroid. So in case of the ligature mark, the subcutaneous tissue underneath the mark is usually hard, white and glistening. So how is the subcutaneous tissue? The subcutaneous tissue under the mark is usually hard white. So the subcutaneous tissue, SAT. The subcutaneous tissue here is going to be hard, white and glistening. So it is hard, it is going to be white as well as it is going to be glistening. Next, we move on to the abrasion and the ecchymosis. Abrasion and the ecchymosis is very common in case of strangulation. Very rare in case of the hanging. The injury to the muscles of the neck. So if you ask if the muscles are injured, it is going to be injured with the muscles of the neck is going to be injured in case of the strangulation. Whereas in hanging, it is rare. So things are very common. So what are common in case of the strangulation? In case of strangulation, the common is the abrasion and ecchymosis as well as injury to the muscles of the neck. Next is, what about the carotid arteries? Carotid artery is the internal cords are usually ruptured in violent cases of long drop. This will be seen in case of the hanging. So hanging has something known as the INICET sign. What is the INICET sign? That is, the internal cords are usually ruptured of a violent cases of a long drop. This is seen in case of the hanging. Whereas in case of the strangulation by ligature, it is going to be damage to the internal cord is there. Then next is the hiated bone fracture. Hyoid bone. So hyoid bone fracture is common with that of the. So when you look at strangulation, there is a lot of injury around the neck structures. So the thyroid cartilage fracture is common. And next, when you look at the cervical vertebrae fracture or dislocation. So cervical vertebrae. So when you look at the cervical vertebrae fracture, so when you ask about cervical vertebrae fracture, it is very common in case of the judicial hammer. To learn and grow daily like this, please do subscribe.